And yet the lockdown deaths, and if you want to talk about a report that we've just released, the lockdown deaths are primarily amongst younger Canadians against the under 45 crowd of people, where the COVID deaths are less than 1% of Canadians under the age of 45. It's 99% non-COVID deaths, okay? And so deaths among young Canadians are up remarkably since lockdowns and vaccine passports, and it cannot be attributed to COVID. And this is based on Statistics Canada data.
And this is
our entire report,
all-cause mortality?
All-cause mortality. Yeah. So three different things. First of all, this is all based on Statistics Canada data. So anybody who disagrees with the report, I say, okay, fine, roll up your sleeves, get to work, and spend many hours going through the Stats Canada data and tell us how and why our interpretation is wrong. And I would love the debate. I think it would be great if somebody rolled up their sleeves and did the hard work that our research, primarily Ben Clausen, there's one researcher, but there's other people involved as well. According to Statistics Canada, COVID deaths went up after more than 80% of the Canadian population got 2 or more injections. The COVID deaths went up from 16,000 in 2020 before the vaccine to 20,000 in 2022 after the vaccine. So, interesting piece of information. 30% increase amongst Canadians under the age of 45. If you look at the death numbers pre-COVID, so 2015 to 2019, you had 257 younger Canadians dying every week. Okay, 257 Canadians under the age of 45 dying every week. After lockdowns, so 2020, 21, 22, 23, in those years, we have a 30% jump, and we get 334 Canadians dying every week under the age of 45, not COVID deaths. So almost a 1/3 increase. Now, the population grew, okay, so that accounts for a little bit, but this jump is more than 3 times as much as population growth. So this is Stats Canada saying there's 30% more younger Canadians are dying after lockdowns and the vaccines, and it's not COVID deaths.
And so I would guess, without having seen the report, that's going to be things like alcoholism-related disease. That's going to be things like male suicide, probably female suicide as well. Other like socially predicated types of mortality.
Could also be like some sudden death, and those get washed out. So those are hard to like pin down without granular data, right?
15% of the deaths are from unknown cause, which is a huge percentage when you think about it. So in 2022, and here we are 3 years later, okay, so this number of unknown cause deaths is not likely to go down because we're 3 years past. And it's not a lack of autopsies. Autopsies are performed in only 6%, 7% of Canadian deaths, right? So 93, 94% of deaths that there's no autopsy performed as such. So that's not really the issue. So we are 3 years past 2022, and we got 15% of younger Canadians under 45 dying of unknown cause. It points to lockdowns in the vaccine. Alcohol-related deaths are up by a fifth, and they have stayed. This is after lockdowns, after vaccine passports, and they've stayed at the higher level. So that's very sad. The number of Canadians dying of drug overdoses up 55% since lockdowns were imposed. Sadly, those rates have remained high. So even today, 2025, we are past the lockdowns, we're past the mandatory vaccinations, but we still have 55% more Canadians dying of drug overdoses than in the pre-COVID years of the 2019, 2018, 2017.
Yeah.
So that's very sad.
And that's not new by any means. It has been well known for decades that any increase of unemployment is always followed with an increase of death.
Yeah.
And that, I believe that was part of the rationale in the Great Barrington Declaration as well. They were pointing out to like, well, we need focus protection because you have a large group that are not at risk of COVID. They're not 70, they're not 80. So you have a large group of healthy working people who, if that unemployment jumps up, that there's a whole range of ways that mortality goes up in them, let it be alcohol or drug abuse or suicide, that all increases. So you've turned a non-at-risk group into a at-risk group in another way through these policies.
And all of this was known. I mean, this is you get back to Matthias Desmet and the psychosis. There was medical research pre-2020 medical literature, which I think it's safe to assume was not biased for or against lockdowns. It might have had other biases in there. Nothing's totally unbiased, but the medical literature pre-lockdowns made it very clear that in-person contact was essential to mental and physical well-being. And so there's abundant research showing that if you are isolated and your only contact with people is by phone or Zoom, right? You're not doing in-person interactions, you have poorer health and a shorter life expectancy. It's bad for you to be connecting with people only by phone and Zoom. We need in-person contacts. That was well established. The unemployment thing, as you mentioned, was well established. There is abundant research. This was ignored even by courts. We had Dr. Kevin Bardosh in one of the Justice Centre's court cases in Ontario. Justice Callahan, I think it was the Randy Hillier case. I'll mention this as well because I've written a book about this called Corrupted by Fear. And we go through the Canadian court rulings. And so Kevin Bardosh did this comprehensive report on lockdown harms. And one of the things he mentioned was, when unemployment goes up, it has a negative impact on life expectancy. More people die when the unemployment is higher. And the judge, he doesn't even look at this report. It was just disgusting. It was disgraceful. He says, well, Kevin Bardosh was not an epidemiologist, so we're going to not listen to anything he has to say, even though his evidence had been admitted and he was recognized as an expert. The judge didn't even go through his report and try to refute what was in the report. We saw this in Manitoba as well, the Gateway Bible Chapel case, where the judge, he has before him a report from the former chief medical officer of Manitoba, Dr. Joel Kettner, just eviscerates the government's case for lockdowns and explains why they're causing more harm than good, on and on and on. And the judge doesn't even mention this report, right? So this report eviscerates the Manitoba government's case for lockdowns. It was open to the judge to explain why the report was wrong. The judge doesn't do that. The judge just doesn't mention the report at all in his court ruling. So this is a challenge we're facing too, and I call the book Corrupted by Fear, because that's the judges, as well as the media, the medical establishment, the legal profession. Everybody's corrupted by fear. And so they're not thinking.